Good morning, everyone. Review the learning objectives for this course. Discuss how the course learning objectives relate to your current and future advanced nursing role. Incorporate research into practice through critical appraisal and synthesis of the most current, relevant, and best evidence based research articles in developing the capstone project. This course has a capstone project that we will work on the entire semester, which is extremely special to this subject. Suppose we now understand evidence based practice. If that is the case, we know that is as healthcare providers, using the evidence based approach allow us to provide optimal care and improve outcomes. This course is essential for understanding evidence based practice as it helps the NPs to develop clinical solutions through evidence based research and incorporate it into our decision making process. The whole understanding of evidence based practice is important because it allows us to provide the most effective care that is available and within our scope of practice to improve the patient's outcomes. This is because our patient expect to receive the best care based on the most recent evidence available. As we read through the course learning outcomes, we can see that it has us understanding how to evaluate and applying evidence-based finding to our advanced nursing role. And the second, develop, implement, and evaluate an evidence based solution to an identified problem or issue encountered in the clinical setting or practice. Because we are the identifying a problem or issue and using evidence based practice to build and implement a plan to address it, we can use it for the capstone project and upcoming position as advanced practice nurse. For example, we have a patient comes into the clinic, they have a specific problems and issues, whereas an advanced practice nurse, we are going to be expected to know how to treat them. We have to use current evidence based practice and current practice guidelines to treat whatever the issue is. And improvement in care can be seen by applying specific recommendation, implement treatment, and based on the research and evaluating the intervention. And the third question, demonstrate a leadership in cooperative effort to develop, implement, evaluate intervention to improve clinical care and healthcare outcomes for diverse population and communities. The highest quality of care will be given, and those measures are intended to improve the general quality of life for all our patients. Working together with the team members to act and evaluate care measures, desire to increase patient satisfaction and treatment for all population and diversities. Incorporate ethical, cultural, legal, spiritual, caring theory, and social issue in the design, implementation, and evaluating of evidence-based object. In order to provide patient-centered care to more patients, it is important to take ethical, cultural, social, and spiritual factors into the consideration. Being culturally competent is important for advanced practitioners. Use information technology and informatics to disseminate evidence-based outcomes that affect healthcare, education practice, and research. Personally, I like using current Medscape up to date, and there are two technology related information resource I always use to treat patient and develop their treatment plans, and for providers to use to provide evidence-based care. Websites applications offer the most recent clinical guidelines using evidence-based practice, update, and confidential guidelines. Review the assignment descriptions posted in each week of the course. What questions or concerns do you have? I'm not sure how much time I have for this course. To be honest, and right now I don't have any questions, probably later on. And overall, what are your goals for this course? And overall, my goals for this course to be learn about evidence-based practice and the leadership and management research method and policy and advocacy. What experience and expertise do you have that you believe will contribute to the learning community for this course? I have experience as a critical care nurse, and I feel like I always have that critical thinking that will help me in the long run. I believe my experience and expertise will contribute to the learning community in this course. Understand the process of managing patient care as a nurse practitioner. My goal for this course to gain a better understanding of the role of the nurse practitioner in providing primary care. Best of luck to everyone.